Hello everybody, I am Dr. M.S. Reddy. I am a psychiatrist. I am a practicing psychiatrist. As I almost about 4 decades of experience since 1980 I have been practicing. I graduated, my undergraduate MBBS was from Tirupati, but after that I went to CMC Vellore to do my post-graduation psychiatry MD. After I finished that, for a short period I was working in CMC itself. Then I came down to Hyderabad for almost, I think it's about 12-13 years. I was in Apollo Hospital as a consultant psychiatrist. Then a group of us have started this hospital, what right now we are practicing, Asha Hospital, which is an exclusive psychiatric hospital which has been there for almost about 2.5 decades. We are a group of psychiatrists, we have started. Asha has multiple centers, an acute care, they have a de-addiction center, we have a old age center, rehab center, wellness clinic. There's a multiple. We are about 30 psychiatrists right now in Asha Hospital. But coming to this particular part of it as the Asha Neuromodulation clinics, this is, I think I can say, it's a kind of a specialty clinic carved out of the entire branch of psychological medicine, because I think maybe you would have seen, this is a clinic focused mainly for depression, management of depressive disorders, management of obsessive compulsive disorders, which is known as OCD, and also tobacco addiction. These are the 3 main conditions. The reason why we talk about these 3 is, number 1, depression, as all of you know, that it's almost about 10% of the population suffer from depression. OCD, it's about 3 to 4%. Tobacco, everybody knows, and how much percentage of population have this problem of tobacco smoking and then addiction. What are the consequences of tobacco smoking? I think everyone knows. There's nobody who doesn't know the kind of a publicity WHO gives, the kind of awareness program they do. Everyone knows what are the problems of smoking, but we all have our own problems in managing that. Now, to put a little bit more focus on neuromodulation. What is this neuromodulation? To tell you, if you look at the psychological disorders and over a period of time, if you look at the last century, the first half of the century, 20th century, there's virtually no medicines in psychological medicine. It's only going to be mostly counseling, psychoanalysis and therapies. The second half, starting from 1950s, there are a lot of medicines which have come into that. Right now I can say that we have very good medicines for the management of a lot of psychological disorders. Very good, very effective medicine, but maybe a little bit of side effects with that. So initially it was counseling, then the pharmacotherapy, medication and effective medication. And in addition to that, there are a small group of patients who do not show much of improvement. Then we were looking for what next after this. That is the time this particular concept of neuromodulation, transcranial magnetic stimulation, neuromodulation has come. This is one of the very young branch. I can say that maybe hardly about a decade and 1.5 decade. What we have the machines here are deep TMS machines. That means transcranial magnetic stimulation. If I can say what it is like, let me explain that. It is stimulating the specific areas of the brain with magnetic pulses. It's from outside, electrical current gets converted into magnetic pulses and again get converted into electrical stimulation. Stimulates the parts of the brain. Which parts of the brain, what areas, for how long, these are all decided in the protocols. Today what we are talking about deep TMS is, this is one particular kind of a machinery what we have, where it has got the facility, the helmet which is used in the stimulation of this, it has got the facility to stimulate much more deeper structures of the brain. I'm sure some of you must have heard about the limbic system, which is much more in the central part of the brain. With this deep TMS, the limbic system, which is the core of emotions, that can be stimulated rather modulated. That is the most advantageous thing about the deep TMS. And I am very happy and proud to say that we have this technology right now, and even maybe proud to say that this is almost maybe the first multi-center deep TMS neuromodulation clinics in India. If you take it in Hyderabad, we have it one in Gachibowli, we have it one in Dilshuk Nagar, we have in Banjara Hills, and we have in other places also, like saying that we have in Bangalore, Mysore, Vijayawada, Vizag, different places we have. So this many places we have started it. This is very young. It's only just about 1 year. We are trying to see how best we can offer the treatment with neuromodulation, mainly to the patient with depression and OCD. I broadly talk about the technique of it. Now looking at the depression, lot of times the treatment available now is, one is medicines. We have very good medicines and also counseling. But there will always be about 30 to 40% of the patients, which is a big number. They don't have a kind of satisfactory improvement with all the other treatments. What do we do? Where do we go with this? Some time back, even now, we use shock treatment, which is on one particular segment of depression. But otherwise, what? That is where, as a third add-on treatment, third line of treatment, neuromodulation comes very handy. The advantages are very safe, outpatient based. You can walk in and walk out. It's about 20-minute sessions. Generally, any patient who can go for an MRI can be suitable for administration of neuromodulation. It's as simple as that. When you go for an MRI, almost 95%, 99% of patients, we all can take MRI, go for an MRI. The similar way here, not many contraindications, but we need to come for a few sessions. For depression, let's say about 18 sessions. For OCD, about 30 sessions. For tobacco addiction, about 10 to 12 sessions. Like that, the number of sessions, the duration, all these are the technical parts of neuromodulation which we talk about. But as a third line treatment, this is very effective. We are quite happy with a lot of patients showing the improvement with this kind of treatment. When there is not much of an improvement, number one, when do you give neuromodulation? If you ask me, number one, when there is not very satisfactory improvement with the medication counseling, then add on this, it's showing good results. There are also some patients who say that, doctor, we don't want medicines. Do you suggest something else? There, we are not prescribing routinely, but we are trying this. There also, quite a few patients are quite happy with this, satisfied with it, but I am not suggesting this. The same with OCD. OCD, if I can take a little bit of time, obsessive compulsive disorder, it's, if you ask me, it's one of the most distressing disorders in psychological medicine. In major disorders like psychosis, bipolar, schizophrenia, patient has a severe problem, but there the patient does not suffer. It's a family who suffers. Patient is, whatever you say, they're blissfully unaware of what is going through. But OCD, classically, patient suffers the maximum. I'll just give you one example of OCD. OCD is nothing but, obsessions are nothing but repetition. Compulsions are doing the same thing again and again. Just to give an example, all of us wash hands. We all do it once, at the most second time. But if you are a patient of obsessive compulsive disorder, especially the washing compulsions, and then contamination, dirt, you wash again, 3 times, 3 into 3, 9 times, 9 into 3, 27 times. Unless they wash the 27 times, they are not happy. They are not relaxed. So the patient knows here that he need not wash, he doesn't have to wash. People look at him as silly, it looks crazy. The whole thing he knows, but he cannot stop. Because if he stops, it's going to be tremendous anxiety. So I'm just giving an example. So if you look at OCD, there are washers, there are checkers, there are hoarders, the blasphemy, and the multiple variety of symptoms you see in OCD. And these are the people who suffer, 3 to 4% of the population, where even medicines are effective but not so effective. But neuromodulation, deep TMS is coming as very handy and very effective. That is one of the advantageous thing about neuromodulation when I talk about Asha Neuromodulation clinics. These are highly specialized, technology-oriented clinics for the management of depression, OCD, tobacco addiction. And we use the technology of deep transcranial magnetic stimulation using brainwave machines, which is one of the very advanced, and then the high cost side also. And we have multi-centers, multiple clinics across Hyderabad, and then the rest of the South India also we have that. And to whatever the best extent we can do, we are trying to extend the treatment for those patients suffering from depression or OCD, and also the tobacco. Here when we talk about tobacco, quite a lot of times, whether you talk about tobacco, whether you talk about alcohol, these addictions are sometimes self-remedial measures for patients in depression and anxiety. When I feel tense, when I feel stressed, what do? I light a cigarette. The more stress I feel, the more cigarettes I light. When my mood is not good, I am depressed, I am sad, and I feel, let me have a drink. See, when you have a drink, when you smoke, it gives a temporary relief from the problem what you're having. Quite a lot of times, unfortunately, these patients with the depression and anxiety, they end up in having addictions. They slowly start taking alcohol every day. They start increasing the number of cigarettes. So these two are linked in a way. Sometimes when you treat a patient for depression, that also helps in the management of tobacco addiction. And that's a kind of a link we see this. But here we are not looking at alcohol addiction, but mostly with the tobacco addictions we are looking at in this clinics. Now, I did talk about tobacco addiction. When somebody has a problem of smoking, goes to the doctor, I want to stop smoking. We have something like a patches and then gums, which are only replacement. When you smoke a cigarette, you inhale nicotine absorbed, but also carbon monoxide and other, like people talk about 400 noxious gases. So if you want to stop, when we give the gum, when we give the patch, we are giving him a smaller doses, harm reduction, gives a small dose of nicotine into the blood. Beyond that, what do you do? Okay, do counseling. Beyond that, what do you do? Okay, we have medication, but as of today, medications are effective, but the efficacy of it is not very satisfactory. In this kind of a background, we have this deep TMS approved for tobacco de-addiction by FDA, which is very recent, just about 2 years back, 2020, US FDA has approved deep TMS for the treatment of tobacco addiction. I think this is something like a very, very innovative kind of a treatment which has come into the practice. But we need to educate people regarding the usefulness of it and then how effective it's going to be. Same thing as I told, the number of sessions, and then plus we do motivational therapy, plus we do replacement like harm reduction, like patches and all we'll give also. It's a kind of a package we do when we talk about tobacco de-addiction. In that area, I say, over a period of time, hopefully, for somebody who is very significantly addicted to smoking, he has an MI, heart attack, he has got other significant lung cancer, but still they fight to control or stop smoking. That is the time deep TMS with the specified like a number of sessions, motivational therapy, and along with the medication can be of great help. That's what we are expecting, we look forward to that. This is what the center mainly is. Deep TMS, depression, OCD, tobacco de-addiction, that is what the focus of it, that is what we are trying to promote, and then see what best kind of a treatment we can offer to the patient along with the medicines and counseling.
Deeply explain the deep TMS.
TMS. See, as I told you, TMS means transcranial magnetic stimulation. This is brain stimulation which we do from the outside. No surgery, no operations, nothing. We put an electrode on the surface of the brain or we put a helmet. And through that, when the electrical current is passed through the helmet, it generates a magnetic force. The magnetic force, once it passes through the bone and the brain tissue, it gets once again converted into the electrical stimulation. The electrical field which is created stimulates the nervous system. I think at this point we all should know, we are basically, all the living beings are basically electrical beings. And I don't think we should go about it. Every single cell what we have in our body, it has got an electrical potential, which we talk about resting membrane potential. So electricity is nothing new to our body. It goes in sync with our body, the entire body parts. When we talk about sodium, potassium, it's a water, sodium, potassium. In the same way, these are all things. It stimulates that. Repeated stimulation produces some kind of a changes in the brain tissue, which we talk about neuroplasticity. See, when I was talking about deep tissues, specific areas of the brain. So here, when we talk about 3 different helmets, each helmet is designed to stimulate a particular area of the brain. Let me put it. H1, one particular helmet which is called H1, when you put it on your head, it mainly stimulates, so maybe I can show it like that, it is this part of the brain. That is a superficial dorsolateral prefrontal cortex. This is a frontal area, dorsolateral prefrontal cortex. That is the main stimulation which is supposed to be effective in the management of depression. Suppose it's OCD, the coil configuration is different. It mainly stimulates the much more internal and down medial and the central part of the brain. So each coil has got a different configuration. Same thing, H4, not like H1, H7, H4 if you talk about tobacco, it is internally, completely, I cannot show from outside, but the central part of it which is insula. H1 for depression,
Color.
H1 which is blue, which is for depression, H7 which is yellow, this is for OCD, H4 green, this is for tobacco de-addiction. So these three different coils, the colors are only for the non-external representation of it, so that you will know from seeing that this is H1 coil, this is H7 and this is H4. It's mainly like that.
How many patients are visiting every day?
Here as on today I can say that on average we are seeing about per month, let me put it like that, like we do about 500 sessions in a month, which is generally a large number. I think the background of it, I told you that we have a Asha hospital also linked with this and all that. So on average about 100 patients in a month, each patient taking from 10 to 20 sessions. Some patients take all the sessions, some patients may not come. It is something it goes like that, 50 to 60. Yeah, that's again another, I think I forgot to mention about it. Starting from the age of, its approval is from the age of 18 to 65. FDA approvals are between the age of 18 to 65. Then suppose you ask, doctor, suppose somebody is 70. Don't give it all? No. Generally we don't. But if a specific indication demands, we do explain to the relatives, we do talk to them, and then we do give, but with taking certain precautions. The same thing below the age of 18 also, but generally 18 to 65. Depression is all ages. Tobacco, mostly it is in the it's mostly the patients in the age group of maybe let's say about 30 to 40, they come for tobacco treatment because youngsters say that they don't bother, they can stop any time. This is the age they start realizing they have been smoking for 10 years, 15 years. Now it's difficult, they would have stopped hundreds of times but continuing like that. That is the age group, mostly they'll be more interested. 30, I am getting into this side of the age, 30 to 45, 50, maybe I am developing diabetes, maybe I am developing hypertension. Oh, this is going to be an additional risk factor. So that is the age group where they get more motivated to come for tobacco de-addiction treatment. Generally, these are depression, OCD, and even addictions are supposed to be neurobiological based disorders. But exercise is one thing which helps universally everything. It's like, I can't say that which part and then how much, but a regular 40-minute walk is the most important thing we all can do, we all must do. Because there are many factors which come. It's a simple thing is it improves blood circulation. And when we talk about some exercise releasing endorphins in the brain, which are like a positive emotion creating thing, which is very clearly obviously. So at least a minimal exercise, which helps in every which way, both to the body and mind. And along with the physical exercise, we also recommend even the least about 15-20 minutes of some kind of relaxation. Where it is simply you sit there and then chant some sloka or chant some mantra or focus on something or keep the body muscles relaxed. Some amount of relaxation which cools down the entire autonomic nervous system and it helps a lot. Coming to the diet, I cannot very specifically say that okay, this particular diet is good for this or good for this. But with tobacco I can say that. I think all of us know. There is a link between smoking and then having coffee, tea, good meal and all that, and alcohol. You have tea, you have coffee, you go and light the cigarette. No, God knows what is the reason. Suppose you cut down on the number of cigarettes, number of teas and coffees, automatically the number of cigarettes come down. Suppose you cut down on your alcohol sitting in the group, the cigarettes come down. No doubt about it. So there is a link between that kind of some restriction on the food and the reduction in the number of cigarettes. It's very clearly. But for depression and OCD, there is no direct link between the kind of a food material you take and then about the diseases. Nothing particularly you see. Depression, every one of you know. Depression is nothing but sadness, but it's not simple sadness. It's something much more. A sadness magnified, a sadness so many times magnified and then suffering to the patient is a depressive disorder. If you ask me to list out, number one, patient doesn't sleep, doesn't feel, everything is negative. No sleep, no appetite, no interest in anything, no work, and then completely feels negative about it. I feel inferior, I feel hopeless, I feel helpless, I am inferior, I am useless. Everything is going down and down and down. And at the end of it, you feel, what's the point in continuing life? This is the extreme. I don't feel like getting up. I don't feel like going to the office today. I can't eat. I lose weight. And then anything, reading paper, watching TV, talking to people, nothing interests them. Somewhere internally, it's a kind of supposed to be a system which involving the neurotransmitters serotonin and norepinephrine, predominantly serotonin, is supposed to be the culprit for this depression. This is how the symptoms go. And one of the major, one of the major risks, I don't say that, I don't want to frighten you, but one of the major risk factors in depression is suicidal attempts and suicides. 15% of patients with depression end their lives committing suicide. So every depressive disorder, we have to treat with, diagnose early, talk to them, diagnose early, and then treat effectively. That's going to be the most important thing. Here one small thing. When we talk about depression, a lot of times, what's the problem? Why are you depressed? Can't you manage? Don't you have the willpower? Do something. Go out for a walk. Go for a movie. And do. These are all the standard suggestions which come. But depressive disorder is something much more than that. It doesn't get relieved by watching movies and reading newspapers and going out and taking holiday. No. It needs to be treated. It's a medical disorder. It needs to be treated. It needs medicines. It needs counseling. It needs a systematic treatment procedure to get him out of it. It is very, very important to know that. This is number one. Our TMS machines were not existent 20 years back. Now it's only for the last 15 years machines have come. The great advantage of this, when I talked about repeatedly deep is that the other machines, if I can show you this, the other machines electrode is like this flat. So when you keep it on the head, it's only the superficial part. So you keep something on the head like this, you keep. The skull thickness itself is almost about 1.5 centimeter. So the deep down, it's only the very, very superficial areas of the brain which get stimulated with the previous electrodes, what we call it, figure of 8 coils. Now with this deep TMS which is coming as a helmet, much more deeper structures, much more internal structures and deeper structures, they can be modulated. That is a major difference. Previously it used to stop at the superficial layers. Then why can't we put more electricity? The more electricity, they can be more superficial, they can be, it's sort of, literally let's talk about much more higher density, electrical field density, which can do some kind of a damage. So that is the advantage of deep TMS. And there are different coils for different disorders. As I told, H1 for depression, H7 for OCD, H4 for, that is the advantage of deep TMS. రైట్ నో చెప్పాను కదండి మీకు, ఇప్పుడు ఇక్కడ గచ్చిబౌలిలో ఒకటి ఉంది, దిల్సుఖ్ నగర్ ఒకటి ఉంది, బంజారా హిల్స్లో ఒకటి ఉంది, 3 మెషిన్స్ ఉంది. 3 ఆశా న్యూరోమాడ్యులేషన్ క్లినిక్స్. విజయవాడలో ఒకటి ఉంది, బెంగళూరులో ఒకటి ఉంది, మైసూర్లో ఒకటి ఉంది, వైజాగ్లో ఒకటి ఉంది. ఇవన్నీ కూడా ఆశా న్యూరోమాడ్యులేషన్ క్లినిక్స్, మల్టీ క్లినిక్స్ వీ హ్యావ్.